Hi, everybody. Welcome back to Fantastic Female Role Models. And today I have another fantastic female who's ready to role model for you. This is Nicole, and she's here to
Hi.
talk about what she does and all the things that make her awesome. So I'm going to hand it over to Nicole, let her introduce herself, and she can tell you all a little bit about her, and then we can get rolling.
Great. Well, thanks for having me, Mike. I'm really excited to chat with you today.
Yeah.
Yeah, so I'm Nicole. I graduated with Mike's wife Chelsea from Lawrence University way back in 2014. Um, I am a mental health therapist living in Minneapolis, Minnesota. Um, and yeah, I live with my fiance Tyler, who also graduated from Lawrence, and our two cats.
Woo, fur babies.
Yes, for babies.
Awesome. So you're a therapist.
Yes.
Um, is there like a particular kind of therapy you do, or is there like a specific like age group that you generally work with?
Yeah. So I work for a company and we see mainly college students in the area,
Okay,
or college-aged folks. So most of my clients go to college here in the cities. I
cool.
do see a few people who are adolescents, so that 12 to 17 range. And then I see a couple people again who are around that college age but aren't necessarily in school right now.
Gotcha. Okay. So you're like, so is your company like specifically targeting these groups because they're obviously, college age kids are stressed, they need this kind of thing?
Yeah. So for a lot of colleges, there's a session limit to
Sure.
their student counseling services. So maybe they can only see someone for 5 to 10 sessions,
Right.
or maybe there's like a 3 month long wait list or something.
Sure.
So we are available to meet with people for as long as they need to. We don't have any sort of session limit or anything, and we often have quite a bit of availability. We're hiring new people all the time, new therapists. So we usually can get people in within a few weeks, and see them for as long as they want.
That's awesome because I feel like you mentioned, like university psych services can only do so much,
Yeah,
and like they
yeah,
can only afford so many people to work with kids.
right.
And if you have a university with like 40,000 people in it,
Yeah,
yeah, that's an
exactly. Yeah,
right.
I think the U has around 75,000 students.
Oh geez.
It's huge. However, a lot of colleges are um, extending their session limit or not having session limits right now due to COVID.
Sure.
So they're able to serve more students, which is fantastic. But there's
Mhm.
still such a need anyway
Right.
that we're still getting so many new clients all the time.
Yeah, I'd imagine. I mean, it's a stressful time. It's been a
Hmm.
stressful year.
Yeah, yeah, for sure.
Yeah, gosh. So what inspired you to be a therapist then, right? What was like the thing that like happened? You were like, yes, this is what I'm gonna do.
Yeah, I wish I had like a really cool story or like a moment where I'm like, yes, this is what I meant to do. But honestly, I knew I liked people and talking to people even in high school. So I
Hmm.
took an AP psych class in high school. I'm like, yeah, this is cool. I could do this forever.
Yeah.
So and then I went to Lawrence and majored in psychology. I'm like, yeah, this is good. I like this.
Mhm.
I don't like anything else. I know I like working with people. I think I'm good at it. I went to grad school, and in grad school, I'm like, yes, this is correct. This is right. This feels good. Um, and yeah, then it just sort of continued.
Yeah. Well, it's nice that you got to be like reaffirmed through your whole process because I feel
Yeah.
like sometimes people are like, I really want to do this. And then they hit like this certain like course or like a certain moment and they're like, they have that like moment where they question whether they want to do this anymore or not.
Absolutely. And I
Right.
realize I'm really lucky and privileged to like have had that. Like I know what I want to do, and I was able to do it. I had the
Right.
access to go to graduate school and everything.
Yeah.
So I'm really lucky in that regard. So yeah, and I did have some of those classes at Lawrence where I'm like, oh man, there's one, I don't know if you remember, by Professor Hetzler, I
Was it
think his name was.
Psychofarm?
Yes.
Yeah,
Yeah.
Chelsea took psychopharm.
Yes, she did.
Yeah.
And it was awful. It was
Yeah.
awful. I got a D, I think a D or D minus, like something that I barely passed the course. And he told me to drop the class when I was in it. And I said, no, I am
Mm,
not doing that.
I am going to get through this and you can't stop me.
Yeah. So,
Yeah.
and I remember that and I didn't quit. And here we are now.
Yeah. Now you're a licensed therapist. So you proved him wrong.
Yes.
Nice.
Exactly, and unfortunately, I wish I remembered some Psycho Farm stuff, and I don't. It would be helpful, but
You know
oh
what
well.
though? Like, from my understanding of the course, because I never took it, it's like it's all about how, you know, drugs and stuff interact with the brain. And like
Yeah,
you don't have to necessarily know all of the in-depth bits and pieces of that unless you're going to be a pharmacologist,
right.
or if you're going to be not a therapist but
Psychiatrist.
right, a
Yeah,
psychiatrist, because then you
yeah,
can actually prescribe medicine, and then
right.
you'd have to understand that. But like if you're just a therapist, you just need to know like kind of like this like a few couple suggestions. You know, go talk to your doctor
Yeah.
about this and this, you know,
Right.
if you're looking for something. And like beyond that, like you don't have to be like an expert in that.
Yeah.
So
Oh, absolutely. Sometimes it could come in handy. I do have a lot of clients who take medication,
right,
and they sometimes ask me, "Hey, do you know what the side effects are? Or what's your experience with
right,
this, and this?" And I always have to say, obviously, like I'm not an expert, I'm not a
right,
med prescriber or anything like that.
mhm,
And this is what I've seen.
right,
I think a little more knowledge could be helpful, but also
mhm,
my brain is not wired to have pure memorization and then
right,
spit it out on a test. And that's all the course was.
mhm.
And that's just not how I learn. So
Well, yeah,
that's okay.
because psychology, we all learn differently.
Exactly.
Yeah,
Mr. Hetzler.
yeah, come
But
on.
that's okay. I know a lot of people really enjoyed the class and did well in the class, and that's great.
Right. Well, you can't enjoy all of them. That's part of
Exactly.
school. Yeah.
Yep.
As a former teacher, I can attest to that. Not everybody enjoyed my class. That's okay.
Yeah,
Yeah. They learned something. That's what mattered.
exactly.
Yeah. Cool. So as a therapist, then you've kind of had a road that you've described as kind of easy, right? You got through it. You didn't have that moment where you're like, oh, this is maybe not be what I want to do. But now that you are a therapist, what are some things that have been really challenging for you
Yeah.
to work with?
Yeah, that's a great question. Because yeah, even though it was easy in the sense of I knew what I wanted to do, I think there have been a lot of challenges that I think a lot of therapists who know what they want to do still face. Some of that imposter syndrome or
Hmm.
just not thinking that I'm doing enough or doing well enough
Right.
um, for a client or in a session,
Hmm.
or not knowing enough, not having enough trainings,
Sure.
because most of us who go into this field are helpers. We want to help everyone.
Right.
And when we're in a situation, I mean, me specifically, that I don't know how I help someone, I like have that identity crisis like, oh my gosh, I can't help this person. What am I going to do?
Right.
So that's challenging. And I think earlier on, it was more challenging just having other people's emotions, like holding on to
Right.
other people's emotions can be challenging. Um, it's hard for 7, 8 hours a day listening to some really traumatic things
Hmm.
that can really wear on a person.
Yeah.
So it was definitely harder in the beginning. And I think over time, people learn different ways to deal with that.
Right.
Yeah, I think those two things stick out though as some of the most challenging.
Yeah. um as an RA, when I was in college, I had to do that kind of, I mean, I wasn't a therapist, but like you end up listening to people talk about their issues.
Yeah.
um and it was interesting, like because I'm also a helper. I really enjoy helping people.
Yeah.
Um, and but when you open yourself up, especially in like a non-official capacity,
Mm.
you become kind of like that go-to person. And so it does become kind of stressful. Like I've kind of felt that it's like that weight of you've got what's going on with you, and then you know you've also got all you're worried about this person because they're telling you about all these things, and you're trying to help, especially when
Mhm.
you're not trained or anything. You're like, I want to do something for you, but
Right.
I don't know what I'm doing.
Yeah.
And so how have you been able to, what are some of the strategies you use to kind of decompress
Mm.
from all of that extra weight
Mhm.
from the people that you have to see and you're trying to help?
Yeah. Yeah, I think consulting or talking with my coworkers or fellow therapists is really, really helpful. A lot harder to do now virtually.
Sure.
I
Right.
remember just popping into my coworkers' offices to just decompress or vent a little bit.
Hmm.
Is so, I don't know, simple but helpful. Just
Hmm.
having another person who knows literally exactly what is going
What you're
on.
going through with
Yeah,
you. Yeah.
it is. Yeah, that's definitely crucial. And I
Hmm.
have a couple of friends who are also therapists. I don't know, Mariah Sievage.
Right.
She graduated, I think, with you,
Yeah.
or a year.
Yeah. She
Yeah,
was, yeah, think
yeah.
so.
So she's a social worker in New York.
Hmm.
So we'll text sometimes, and of course, not about clients or any confidential stuff, but just, hey, I'm having a hard day. This is what's going on. Can I rant to you? And
Yeah.
then it just feels a lot better to unload, which is that's something I tell my clients. Like sometimes it just feels good to talk and have
Right.
someone validate and listen to you. Same
Hmm.
thing for therapists or for anyone who's not even in therapy.
Right.
Um, so it's really helpful. And then um, disconnecting from right now from my computer, but
Right.
just disconnecting from work
Hmm.
in general. Making sure I shut my computer and leave my bedroom where my office is now
Right.
for the day and trying not to spend more time in here than I have to.
Sure.
Um, just to get out of the headspace a little bit and doing hobbies. Like I've been reading a lot, playing the Switch, watching TV and movies, just finding other things to do so I'm not thinking about work.
Right. Right. That makes sense. I know I used to spend a lot of time playing video games after those sorts of things because, like, all right, I'm
Yeah.
going to think about anything else than that. And it works.
Yeah.
So,
Yeah.
yeah, got to learn how to code switch.
Exactly. Yeah.
Yeah.
Coping skills I think are like therapy 101 because literally everyone needs a coping skill
Right.
to deal with life.
Yeah. That's, yes. Nothing I could add on to that. That's true. Awesome. Cool. So on your path to becoming a therapist, have there been any kind of like obstacles that have been put in your way specifically because you were a woman,
Mhm.
or have you kind of dodged that issue in your professional
Yeah.
life?
Yeah, I think therapy is actually a pretty woman dominated field.
Sure.
For like, women are seen as more nurturing or helpful. So I
Right.
think we're almost funneled, not funneled, but it's an appropriate career
Career decision
for
for you to
us.
make.
Yeah,
Yeah.
yeah.
Hmm.
Like in my grad program, there were maybe 30 of us. And I think I could count the number of men in our program on my hand.
Sure.
Um, so it was probably easier for me than for a man to get into it. And I've had many clients or people in general say, "Oh, I'd rather talk to a woman than a man
Sure.
for various reasons."
Hmm.
And I've quick story. So I used to work in a rehab center for teenage boys.
Hmm.
Um, and in that area, I really wish that I would have had a man
A male
coworker,
colleague. Yeah.
yeah, to help these young men with some of their stuff and help me know and relate to them a little bit differently.
Right.
So yeah, kind of answered your question. No, not really obstacles as a woman, but wishing there were more men and people of color, BIPOC, trans folks in our field
Right.
because we desperately need diversity. Our field is dominated by white women, and
Right.
that's not going to help
Everybody.
everyone.
Right.
Yeah. Yeah.
Yeah, I feel the same way as a teacher. I especially as a male teacher who
Yeah.
taught under high school, because I worked at a school that was K through 8,
Hmm.
and we had 4 men in the building, and it was me, another teacher, the principal, because most administrators are men,
Hmm.
and then the janitor. So,
Hmm.
like, of people to relate to, these kids only got 4 options,
Right.
and most of the kids weren't going to pick the janitor. So really, it was 3. Um, and I feel lucky because I had 2 male teachers in my elementary school, and I got both of them. So I managed to have those experiences with
Mm.
someone who was the same as me. But I realized that a lot of kids don't. The school I
Mhm.
work in now is very racially diverse, and low income, and all of the teachers except for like 2 or 3 are white women. And it's like, I know that they're elementary school kids, they love their teachers pretty much no matter what. Like, that's just
Right.
kind of like how elementary kids are. But um, it's probably hard for those kids to only see people who are different to
Right.
look up to. They don't have
Yeah.
those kind of role models in school. So
Yeah.
I would agree with you that there's a lot of fields that need to diversify, especially the ones that are
Absolutely.
so critical like ours. Uh,
Yeah, yeah. I'm sure it's the same for teaching, but I think there was a study that showed people tend to have better outcomes when their therapist looks like them,
sure.
um,
Yeah.
because you have that relationship. Um,
Right.
and the relationship in therapy, probably similar in teaching, is going to be the biggest indicator of outcome.
Right.
It's like something like 60%. Um, 60% of like what makes up a success rate for whatever success is in therapy
Right.
um, is the relationship you have with your therapist. So if it's a
Right.
strong relationship, you're more likely to feel better, feel like
Or
it
yeah,
worked
and
for
get what you
you.
need out of it.
Yeah,
Yeah, and I would say that the same thing probably is with, I don't know if there's a study, I can't pull numbers out of my head like that.
sure.
But like, I would say that probably in education it's the same way. I, as someone who grew up in a suburb of a big city, I had teachers that looked like me, and I had models of success to look at,
Mhm,
and I succeeded.
mhm,
And you know, I feel like even in areas where there should be more teachers of color, teachers of different ethnicities, people with different gender identities, um, it's so few and far between that it's hard to find, even in and it's all luck. It's
mhm.
like, are you in the district with the kid with the awesome school with all the cool diverse teachers? I don't know, maybe.
Yeah,
Um,
yeah,
but and it's the same thing with therapists. There probably are a bunch of really cool
yeah.
therapists that are of different identities, but they're not all in Minneapolis,
Right.
Minnesota. Yeah, so it's
You.
like,
Yeah.
what are you gonna do?
Right. Yeah, and it's obviously that systemic problem, the oppression and
Right.
um, you
Hmm.
know that that is a barrier for folks who aren't white women to get into therapy. Um, so yeah, I know a lot of, I shouldn't say a lot of companies. I know our company and others and nonprofits are doing what they can, or at least it's on their mind to figure out how to either attract more people of color and BIPOC folks to work at companies, how to um, find people because they're out there. It's
Hmm.
not like there aren't
Yeah.
therapists who aren't white women.
Hmm.
We have to find them. It's not their job to,
Come to you.
make us do right, right.
Right.
It's our job to make our workplace more diverse.
Right.
So yeah.
Yeah. Awesome. So, hmm, deciding which question I want to ask you.
Sure.
Oh yeah, it's early in the morning for me.
Same.
Yeah, gotta love before noon meetings. Um, so so as a therapist, you've only been doing it what for is it been 2 or 3 years now?
About 3.5.
3.5. So in those 3.5 years, what do you think your greatest accomplishment as a therapist has been? You don't have to give I know all about HIPAA and stuff, but
Yeah,
if you
yeah.
can, yeah, describe it generally.
That's a great question. I don't I don't know if I have a biggest accomplishment. And maybe if I like went through all my clients, I could maybe pull out someone, but I think a couple stories come to mind, where just generally people say things like, "Oh my gosh, I've never told anyone this before,"
Right.
or "I feel so much better."
Hmm.
Um, I was working with a person when I was still in Iowa, and I had worked with them for close to a year or over a year.
Yeah.
And they had come in with some trauma, like pretty. I don't like to scale trauma, but they had trauma
Yeah.
that they haven't really talked about.
Right.
And a year, and we didn't even address it all the time. It was more of a let's talk about it sometimes. Let's talk about some other things. Let's talk about self esteem. And,
Right.
we got there
Hmm.
eventually. Um, and then I moved to Minnesota, so I had to stop seeing them.
Hmm.
And, they said some really beautiful things. Like they feel so much better about themselves. They have really, really started to work through and started to heal,
Right.
because trauma isn't something you just like get over, like, oh, I talked about it and now I'm
Now
fine.
I'm perfect.
Right. Right.
Yeah.
So, but for them, they really started on that path of healing,
Right.
which was really beautiful to see. And they actually sent me we she sent me a message
Hmm.
later that was just a really beautiful message. And as much as I don't want praise or that kind of stuff, it did feel really nice because therapists don't often get to see outcomes of our clients, right? They leave and then they go on to do really Um, things that we don't see.
Right. You don't
So
get
it
to
was really
see the end
nice.
result of that kind of thing.
Exactly,
Right.
which is fine. I don't need to.
Hmm.
But once in a while, so they messaged me and it was just really nice. I feel so much better. You helped me so much. I'm really going to miss you.
Hmm.
Things like that. So that
Yeah.
was really nice to hear, knowing that I made an impact on this young person, and knowing that they're gonna really do really amazing things
Hmm.
in their life. And I got to
Right.
be a part of it for a really short time.
Yeah. Well, and sometimes the big accomplishments aren't even they don't seem that big, because
Yeah,
like it's like, oh, I got this person to open up, and like
yeah,
in the grand scale of their therapy, that might be like a really small component of it, but
yeah.
the fact that you got them there is an accomplishment because
Mhm.
like I know when I first went to therapy, I was very much I wanted to go, but I also was kind of like, I don't really want to talk too much about certain things.
Mhm.
Everybody has the things they don't want to talk about.
Yeah.
And it took me two therapists and several tries, but at a certain point, right, they got me
Yeah.
to talk about it. And
Mhm.
that was in the long run, it was a very small part of what ended up becoming much more.
Mhm.
But that was the big accomplishment was getting me to actually talk about it.
Yeah.
So yeah, I'd say that's a big accomplishment is
Yeah. Yeah,
getting
and
people to open up.
right, and I think like you said, it's really cool that you were able to open up eventually, and it's okay that it takes multiple therapists. It's okay that you didn't click with someone right away. I tell that to people all the time.
Right.
Um, and you don't have to talk about the big scary thing right away either.
Right.
You can build up to it, or some people say it the first time they
Right.
meet their therapist because they just can't hold it in any longer.
Right.
So I think that's really neat.
Hmm. Well, that probably makes, I guess, makes your job like a little bit harder, right? Because you've got this end, I mean, therapy, right? What is the end goal of therapy,
Right.
but like at some point there's this end goal that you're trying to get to, right? You're trying to get them to talk about whatever it is that's bothering them and really work through it.
Mhm.
Um, and then of course you've got that variability of humanity. Like, are they going to, how easy is it going to be to get to that point? Are they going to come out and tell me right away, or are we going to have to work through X number of sessions before they feel comfortable enough to even broach the topic with me?
Mhm.
That probably causes you to adapt and change kind of your strategy a little bit.
Yeah, yeah. I think directness is something I've developed over the past few years, but being able to be direct with the client if they really aren't getting to what they want to talk about. Oftentimes they tell me right away, "Oh, I want to talk about X."
Yeah,
And I'm like, "Great." Or,
let's
"Hey,
talk about
this
that. Yeah.
yeah, like, "Oh, hey, this trauma happened to me and I want to talk about it." I'm like, "Cool, great." And I do say like, "We will go at your own pace."
Hmm.
And then, after a few sessions, if things start to feel like there isn't
The substance of
something
it.
there, yeah,
Right.
yeah, I'll say flat out, "Hey, I'm feeling like we aren't getting to what you wanted to talk about. Is that still something you want to talk about? Or how are you feeling about this? Do you want
Right.
to keep going?" Just kind of gauge where they're at
Yeah.
because they know why they're there. I know why they're there.
Hmm.
Sometimes other things come out and they're like, "Oh shoot, I never knew that's what I needed to talk about."
Right.
Um, so it's being comfortable with some of those direct questions, definitely, and that doesn't happen much with the age range that I work with.
Sure.
Usually they're like, "I want to talk about my breakup." And then they talk about that, and then we find other things that are going on too, maybe
Right.
deeper down.
Yeah.
Uh, yeah,
Because that's like a symptom of what's already happening. And
right.
then, yeah, and then they realize, oh man,
Yeah.
yeah, kids. Yeah. Yeah. I get to see little bits of that too with
I
like,
bet.
and they're even like, they're like 6 and you're like, oh, okay.
Yeah, definitely.
Yeah. But in my position, I can't be like, you should talk to somebody about that. It's more of like, that's nice. And then
Yeah,
you walk down the hallway and you're like, you should talk to Billy.
right, right. To the school counselor, like, maybe you should pull in this kiddo.
Maybe you should pull in that whole class. Let's get them all in there and see how
Yeah,
they're feeling.
yeah,
Yeah.
yeah.
But my school actually has a school counselor that meets with the kids regularly, all of
Oh,
them.
that's wonderful.
Yeah. So they had, and that's something that my school in particular does. I don't think other schools in the district do that, but because
Mm,
of kind of the makeup of that school in particular,
yeah.
they have weekly or biweekly, or
Wow.
not biweekly, every 2 weeks. How
Yeah.
do you say that one? Is that biweekly?
I think it's
Is that
biweekly,
bi-monthly?
bi-monthly.
Whatever. They they talk to their school counselor a lot. It's good. It's a good
Yeah,
thing.
exactly.
Yeah,
Yeah,
good things
and
are
that's
happening.
that's really incredible because I know, at least here in Minnesota, the people I graduated with, a good chunk went on to become school counselors. And they're
Mhm.
often like one school counselor for 100, 200 students or
Right.
more,
Yeah.
which they can't see every single kiddo,
Right.
monthly even.
Right.
Um, and then it's phone calls to parents or
Mhm.
child protective service calls and
Right.
trainings, and it's exhausting. School
Mhm.
counseling can be obviously all of counseling is difficult, but difficult for because of other issues going on too.
Right. I know my high school, like my graduating class was over 600 kids, so my school was really big. And
Yeah.
like we had one school counselor for the whole school. And it's like, how could he possibly manage to keep track
Yeah.
of 2,400 kids,
Yeah.
by himself? I mean, like he got referrals and stuff, and there are obviously kids who needed it more than like other kids, but like that's that's an insane,
Yeah.
mandate to be in charge of those kids, I guess
Hmm.
technically.
Hmm.
That's his dominion.
Right.
And whereas like you get your handful of clients from your company, that's a much more manageable and reasonable expectation.
Right.
Yeah,
Exactly.
right. Yeah, Nicole doesn't have to worry about getting overworked. She
Well,
I mean, maybe a little
well,
bit, maybe a little bit.
well, yeah. I mean, we do have people on wait lists, and
Right,
different places have different session quotas.
sure.
So typically, you work for a place, whether it's a company, a nonprofit, a clinic, whatever,
Mhm,
you have a certain amount of people you're expected to see in a week in
sure,
order to keep up productivity or quota,
of course.
which,
Yeah,
yeah, profit.
yeah,
Um, so that's something that's another like external barrier, I think, especially during COVID, where I'm staring at a computer 8 hours a day.
right.
Um, and I have to, I can see up to 33 people in a week,
Mhm,
which is
it's
quite
a
a
lot.
lot of people. Yeah,
Yeah,
yeah.
okay,
But
yeah,
I, definitely a different sort of schedule than a school counselor who unfortunately, can get somewhere between 15 minutes to 45 minutes maybe with a kiddo
right,
when maybe they need a lot more time.
right,
So that, extra barrier for them too.
right. Well, and they can't detract from their education either, so you have to do it within school hours,
Right,
but you also can't take them, from math
right.
and have them, talk with you, even though that's probably what they really need, because they're not going to learn math if they're
Yeah,
thinking about everything else. But,
exactly.
schools, a whole nother video is worth of
Oh, I'm sure.
discussion. Yeah. So kind of bringing it all together, um, if someone wanted to be like you, a therapist, someone who's a helper, maybe even if they don't want to end up being a therapist, but they want to make sure they can help people,
Mhm.
um, what kind of advice could you give them? What kind of
Hmm,
classes should they sign up for?
hmm,
What kind of things should they be thinking about for their future?
hmm. That's a great question. I think classes are a little less important. Um, Loved Lawrence. Psych
Mhm,
was great.
right,
Not crucial to what I'm doing now.
right,
Um, Honestly, I think my gender studies major helped me more than my psych major did. Um, but I don't know. I think if you want to be a therapist, you want to be a helper, you find people who can mentor you or be a guide.
mhm,
Um, Ask them questions. I've answered questions for many people who are like, I don't know what grad school to go to. How do I know what program to go to?
right,
So I've talked to people about it, and I don't tell them which to go to, but again, more of a sounding board, giving
right,
them that knowledge that is not easily accessible
mhm,
necessarily.
right,
So I would say find a good mentor, person who's in the field that you want, and talk to them and ask them all the questions that you have.
mhm,
And then, I don't know, do a little research. There are a lot of jobs that are really similar: counselor, social worker, school counselor, um, college counselor, career counselor,
right,
advisors. Um, a lot of those are really similar. But if, doing a little bit of research on each one can help you figure out which can help fit
right.
you
Which
better.
track you want to go down?
Yeah, yeah,
Yeah, awesome.
yeah. So I think that's it. Maybe.
Yeah, that makes sense. I
Yeah.
mean, yeah, if you find someone who can help you, then you can't always be a helper by yourself. You got to have
Exa-
other helpers
yeah.
help you.
Exactly. That's a big one. You can't just be a helper. You need help too,
Okay.
and that's okay.
Yes. There we go. We did it. We
Yes,
got
we
it. We
did
got
it.
there. Awesome. So just one more thing I really wanted to
Yeah.
talk about.
Yeah.
And I know it doesn't necessarily relate to like your job as a therapist or anything, but you can't tell
Sure.
from the way we're sitting right now. But Nicole, she uses a scooter
Oh yeah,
to get around. Yep, there's our
scooter.
friend. Ooh, did you get a new one?
Yeah, last November 2019.
Upgrade.
Yeah, well,
Yeah, because I
sure,
remember the
we'll
one
go
at
with that.
Lawrence by the end of it was getting a little.
Yeah,
Yeah, yeah,
not great.
right, exactly. So I know pretty well that really had never really has inhibited you. You seem to, that doesn't bother you. You do your things, you do you. Um, but from maybe from the outside, people might see that as a disadvantage or
Mm-hmm.
as something that would hold you back. Do you want to
Yeah.
talk a little bit about that? Kind of how maybe it's not really an obstacle, but maybe something that's made you stronger, better, whatever, however you want to say it.
Yeah, absolutely. So, just kind of a background. So, I have muscular dystrophy. Um, for lack of science that I don't know very well, muscles are weaker in most of my body. So, I
Hmm.
use the scooter to, get around most places. I do walk around my apartment a little bit, and I
Hmm.
can like walk a bit. Um, but yeah, certainly not a disadvantage. And again, I'm really privileged to have a disability that's not life threatening. My
Sure.
my lungs are fine, my heart's fine for the most part. So I'm not in a huge risk. I don't have a huge risk of passing away from my disability.
Right.
But I mean, scooter specifically is certainly more of an advantage and helps with freedom more than a disadvantage. If I didn't
Right.
have that, I couldn't get around, I couldn't leave.
Right.
Um, and I literally can't imagine my life any other way just because it's been like this all 28 years of my life. I've
Sure.
met some of my best friends because I'm disabled.
Hmm.
I have a different outlook on the world and I think more in touch with others and have a lot more empathy because of it.
Right.
Um, I have my days here and there, just like everyone does, where I'm like, man, this kind of sucks. Um,
Right.
and honestly, it's more about the world sucks for people with disabilities and less
Right.
about what I have sucks.
Right.
Again, because it's not life threatening, but you know, the sidewalks not being shoveled or the
Right.
roads being difficult to
Particularly
maneuver.
icky. Yeah.
Yeah, yeah, that is very annoying, but that's
Yeah.
not my fault.
Right.
That's the
Uh,
society and ableism.
right.
Um, so yeah, that's I think maybe a brief overview.
Yeah. No, I mean that makes sense. Um, yeah, because um, yeah, I remember, you know, I was at Lawrence. We'd be, you were you were always around. You always did all the things, right? And and some people would be like, "Oh, she's in a chair," and I'm like,
Mhm.
"Yeah, but she's Nicole and she's awesome. Like, who cares?"
Yeah,
And like, you still do awesome stuff.
yeah.
You just happen to be, you have muscular dystrophy. Like,
Hmm.
it doesn't change how awesome you are. It just means that you can't walk as much as the rest of us, and
Right.
you get a cool scooter and you can honk at people.
Yeah, I think I don't know why it's like this. Well, I kind of do. But with disabilities, people for some reason like get really awkward, and maybe it's all isms, but people get super awkward around disabled people.
Hmm.
And it's wild to me because we're people,
Yeah.
right? Like,
Yeah.
yep, we do things like go to college parties and we have, you know, partners and we fail classes or get really good grades.
Right.
And also we have other things going on too.
Right.
Um, yeah, it's also a podcast probably that could be a
Whole
whole
thing. Whole
thing. But
thing.
yeah, yeah. Um, yeah, I think my number one, I don't know, advice for people is like just ask if you have a question, and don't be awkward or weird about it. Like, we're
Right.
not extra cool because we're disabled, and we're not less cool. We're just normal people. Some of us are mean, some of us are nice. So,
Right.
we're just people. So,
Right.
yeah.
And I guess maybe to comment on like the awkwardness as someone who does not have a
Hmm.
visible disability, right? I feel like I always think of it kind of as like, what would a little kid do if they
Mm.
saw, right? Because they don't experience that kind of thing normally in
Yeah.
their lives.
Yeah.
And so they always do something super awkward or weird whenever they see someone different
Yeah.
because they literally just don't know, like,
Yeah.
I remember, to talk about my kid a little bit,
Yes.
we were out for dinner and we're hanging out and we're eating. And this wasn't even like a disability. Like there was like a prom going on. And so people were coming to eat at the table next to us. And so
Mhm.
they're all dressed up and they're wearing all
Mhm.
these like fancy dresses. And my son just keeps looking over like, whoa, like what is going on? Because he's never really seen that before. Like we don't
Right.
dress up in front of him. We don't do that
Right.
kind of stuff. And so he's only really seen it in like movies.
Oh my
And
gosh.
so he thinks that he's sitting next to a table full of princesses and and of course he he's like hey mom, and Chelsea's like what's going on, he's like that girl looks like a princess, and she's like why don't you go tell her that, and he's like okay, like
Oh,
classic like 3-year-old, and he like gets
yes.
up, runs over, like grabs this girl's arm, and she like turns and looks like what is going on, and there's this like 3-year-old blonde kid standing there, and he's like you're so pretty. You look like a princess. And she's like,
Oh
oh,
my god.
thank you. Like he clearly
Oh,
made her night. And like
yes.
that's like the nice end of that kind of reaction. But I feel like a
Yes.
lot of people default to the other way, the other
Yeah.
option where they see something different that they're not really
Yep.
familiar with, and they immediately go, oh,
Right.
like that must be awful. Or, oh,
Yeah.
that poor person, she's in a chair. Or,
Mhm.
it's like, or you see someone maybe who has like autism or uh, another one I'm thinking of. There's all sorts of different things you could see,
Mhm.
and they immediately like they start talking to that person like they're a child, and
Yeah.
it's like, well, okay, you could do that, but like those are still people. Um,
Right.
yeah, and it gets to what you were talking about, like their immediate response is to kind of internally shudder and then do something really awkward. And I feel
Yeah.
like that's just something that's kind of ingrained in us as children, as curious children.
Yeah.
Like you're taught to be to explore and figure stuff out. And when you're a little
Right.
kid, we don't do the best job being like, okay, now, sweetie, I know that you're excited and you want to find out, but
Yeah.
you can't
But
just go and, or like when you're a kid you say something super awkward and then your mom's like don't do that, that's rude.
right.
Right.
That's
And
the I think that's the opposite of what parents need to do, though. Like,
right.
Chelsea encouraging Cam to go up to that girl, I think, is exactly what parents should do instead of don't stare and don't look at that person. Yeah,
Right.
you can look, you can ask me questions. I am much more forgiving of children who ask me questions because they're literally just curious.
Right.
And the more I can help them understand as a child, the
Right.
better adult they are going to be. I remember maybe it was a year or two after graduation, we came back for something.
Yeah.
We always go back to Lawrence
Yeah.
pre-COVID.
Always have to come back. It's
Always got to go
part of
back.
the deal.
And I remember you and Chelsea and Cam being there, and I took Cam around on my scooter, and we drove around Andrew Commons. And he's not going to remember that because he's like 1 or 2 years old.
No, he has no
But
idea who you are.
yeah, but um, that's still an experience, and maybe that made some impression somewhere in his little baby brain. I don't
Right.
know. I should
Mhm.
know, but I don't. Um, and it just helps children know that disabled people are not taboo, we're not weird, we're not bad to talk to or to look at, but
Right.
ask us questions and be curious
Mhm.
so you're not a jerk as an adult.
Yeah. Well, and I think that applies to just about anything,
Yeah.
whether it's race or sex or gender or anything,
Mhm.
I feel like as a country, not to well, whatever. I'm pretty open about how I feel on this show. As a country, we're so willing to kind of do that
Mhm.
differences, and we're
Mhm.
very much into pushing it away and being like, don't look at that, don't talk about it. We're, don't do those sorts of things.
Right.
And I think that's really part of our issue, is that we tell kids not to think, talk, look, do any of those things. We never have those conversations with kids. And yeah, they're awkward, and yeah, they're probably a little bit uncomfortable. And some of the people who shouldn't have those conversations with kids probably are. But it's one of those things where if we don't even broach the subject, how are we going to improve?
Yeah.
And I think what's cool about what we do, since we both, I guess we're both are in helper professions, is that we get to, with the limitations that are put on us, we get to broach those subjects a little bit.
Oh yeah.
Because I know because of my position, I can't really have all those conversations with kids because I'm not a teacher anymore. So like,
right.
And even when I was a teacher, there were limits onto what I was able to say and what I was able to do. But now I'm not even, in charge. So like, I can't really talk about it at all, which is a bummer. But
yeah,
whatever.
that's tough. I imagine that's really tough. I have a little more freedom, and I think each individual therapist decides how open or how not open they are.
Right.
And since I work with mostly college students, mostly adults, and some adolescents, I'm also pretty open about my beliefs because we bring biases in no matter what.
Right.
My therapy is going to be shaped by what I believe. And
Sure.
I talk a lot about like anti-capitalism and like anti-producing
Right.
because that instills a lot of guilt and shame, and especially college students. But
Sure. Yeah.
and I bring things up sometimes like white privilege to some of my kids, or I don't even know, but I'll bring it
Right.
up if I see it. Or when I was working with teenage boys, if they would say something completely
Not okay.
wrong, for lack of a better, yeah, not okay, I'd be like, we don't talk like that here, and
Mhm.
this is why. We don't say that word,
Mhm.
and you are not going to say that word in my office.
Nor
Um,
should you say it outside of my office, but
right, right.
I'm not there to
I
tell you
can't
no.
control that.
Yeah.
Yeah, and that was another example where kids, they were older kids, 16, 17, really interested in me and my scooter, didn't really treat me different, which I
Right.
was a little surprised, but in like a very pleasant surprise. Um,
Yeah, I feel like the kid, not to generalize, but I feel like Generation Z or whatever is
yeah,
very much open, or a little more open to those kind of differences than
yeah.
maybe even our generation was,
Oh yeah.
which is saying
Oh yeah.
something, because I feel like our generation is pretty cool relatively with things
Yeah.
like that. And
Yeah.
like, and they're so, we're trending well. So hooray.
I
Yeah.
hope so. I think these Gen Z kids are pretty amazing and really in touch for the most part. Um, yeah, I mean these kids who I worked with, they were using a lot of drugs and had a lot of um, problems with not getting in trouble, legal involvement, trauma,
Right.
and here they are interacting with their little tiny therapist who's in a scooter, and they pretty much didn't care. They would do some annoying things because they're 16-year-old boys,
Yes.
and that's what happens. But they weren't they it was way better to work with them, I think, than adults would have been, because
Sure.
adults wouldn't acknowledge it at all.
Right.
But they did, and it was fun. So,
Right.
kind of a tangent, but circling back, kids are cool and they are allowed to be curious and ask questions, and so are adults.
Right.
But
Yeah. No more question stigma.
yeah,
No more.
right.
Here we go.
And it's about how to ask a question though. Like,
That
don't
too.
come up to me or someone else and say, "What happened to you?" Well,
Right.
I was born.
You got to
Yeah,
come up with a really dramatic story.
I know that's what people have told me, and I don't think I could keep a straight face. Like, oh my gosh, what happened to you? I think in high school or middle school, people assumed I got into a car accident.
Oh
And I'm
yeah,
like,
that
what?
seems like a
I don't, do you know how car accidents work? Like, I wouldn't be in a scooter.
yeah.
Okay, okay. I wasn't, but thank you. Yeah.
Yeah. Well, I was gonna say like something like, well, I was in the war.
Right.
Yeah. And they're
Yeah.
like, what war? And you'd be like, obviously the battle for
The-
Middle Earth. What are you talking about?
no, I was gonna. Oh, I lost my leg in Nam, or something.
Yes. I look very good for my age.
Yeah, I went to space and went through one of those wormholes, age backwards.
Mm-hmm.
Right.
Yep. Mm-hmm. Yep.
But
I used to
yeah.
be a professional wrestler and I got hit too many times. And so now
So now I
my
use my scooter.
my body's just kind of given up on me a little bit, but that's
Hmm.
okay. I'm still an independent wrestler. You can't can't
Right.
stop
Like, do you
me.
want to fight? You want to
Yeah.
fight?
Do you want it? Because I'll win.
Uh,
I'm a professional.
right.
Yeah.
Oh my gosh.
Nice.
Yeah. So
Fantastic.
definitely how to ask a question. It's not about what happened to you, what's wrong with you.
Right.
Um, I can't even think of other ones. Did you get into a car accident? Like,
Yeah.
even why do you have a scooter is way better than
Sure.
any of those.
Right.
Most people who are trying to be really nice just sort of gesture and like, can I ask? And they don't know the words. They're trying to be really polite,
Right.
and I appreciate that. They're not trying to say what's wrong, but also they're like, Scooter, can I words?
Mhm. Right.
So yeah.
So as someone who's trying to keep up with the vocabulary, what is the word that you would use to describe yourself?
Yeah. So me personally, I say disabled.
Okay.
I think it's simple and to the point.
Hmm.
I don't want to speak for all disabled folks, and I've seen sort of a shift away from, obviously, away from, don't say differently abled or handy capable.
Yeah,
Some people may be okay with that.
those sound very patronizing to me.
Exactly. Really
Yeah.
patronizing. And we're moving away from the word disabled when it's not a bad word.
Right.
Being disabled isn't bad. It's
Hmm.
just a thing.
Right.
So
Right.
definitely, and not special needs even. I know
Right.
that's big in school, or what's big in schools. I
It
don't know
still
if it
is
is
big in
anymore.
school. They still use it.
Yeah.
Yeah.
Yeah. And again, kind of patronizing. And I get it to a point, oh, a special needs kid.
Hmm.
But just say a kid with X, a kid with Down syndrome, a
Right.
kid with autism.
Right.
That's way better than
Hmm.
special needs.
I hear special needs more from older teachers who are still using it.
Yeah.
Whereas I know in the special ed community, they are shifting more towards that.
Yeah.
Um, because obviously it's just a better way of talking about it. But
Right.
you know, I feel like a lot of, and maybe this is once again just a generational thing, but I feel like a lot of older people like to dance around it, you know, oh, you have special needs. Well, what are my special needs? Well, don't worry about that part. Like
Right.
right. But
And special. I think special is just a weird word.
right.
I don't want to be I'm not special for being disabled.
Right.
I'm
It
I'm
draws
normal.
attention to your differences,
Yeah.
whether, instead of, talking about how you're also the same as all these other
Yeah.
kids.
Yeah.
But I think
And
that's also
also,
kind of it's kind of the way school is set up, because the way the law is written, it's about, people who require special education plans. The goal is to have them be as mainstream as possible. But
right.
by setting it up that way, you're saying that they're different, which they are. They have differences,
Yep.
but every kid
Yep.
is different. Um, but you're putting them into this box, and you're
Right.
saying, well, they're not like these kids, and so you're kind of invoking that terminology
Yeah.
by how we're defining it, which is, I feel like something that they're working on, but also that law has been on the books for years and they haven't
Right.
changed it. So it's,
Right.
you can't really change it without changing the wording in the law. So
Yeah. Yeah.
it's, yeah, there's all sorts of other issues to deal with in that sense.
Right.
Yeah.
Things things need to improve a little, but yeah, just I don't know, the word special too even makes disabled folks seem like children or
Right.
like, oh, you're special, oh, you're so cool, you're so nice.
Hmm.
Like, oh my gosh, you're such an inspiration. That's the worst. Like calling someone an inspiration.
Just because they're like, yeah,
Yeah.
yeah,
But also, like I kind of said before, people with disabilities can be jerks too. Like,
yeah. Hmm.
not, I could be the meanest person ever. And someone would be like, oh, you're so cute. You're so sweet. Oh, like, look at you going to the store. Listen. Right. Right. So it's
Right.
kind of wild sometimes how people treat disabled folks, but
By the way, I
we're
can't imagine
working
you
on it.
being the meanest person. So
No,
so
I know.
that's funny to me. I'm
Yeah.
trying to like
Yeah.
imagine that in my head, and it's like doesn't work. Doesn't
I
work.
know.
Yeah. It's
I
because I
know.
know you.
I'm
I think I know you too well, so that's part of the issue.
Yeah. I mean, I think I have one of those faces that instead of the resting like bitch face, it's a I can't do that.
Can't be cross.
No, I'm often smiling most of the time, which is not always great. Sometimes I want to be like, don't approach me, don't talk to me.
Right.
But then it's just,
But then you start smiling anyway.
and I'm like, ugh, don't talk to me anyway. Yeah,
Yeah. Oh well. Things happen.
yeah.
Yeah. Awesome. Well, I've got nothing else to ask.
Cool.
I think we've covered everything I wanted
Yeah,
to talk
yeah.
about. Is there anything that you wanted to get out there since you have this soapbox that I have presented you with? It can be about
Yeah,
anything. It doesn't have to be at all related to what we've talked about. You can just,
sure.
yeah,
Oh,
whatever you
I
want to
don't
say.
know.
The floor is yours.
Go to therapy if you want to, even if you don't think you need it. Try it out. It's gonna be awkward at first, and then it's good.
Right.
And if you don't like your first therapist, find another
Find a
one.
second therapist. Yeah.
Yep, or a third,
Mhm.
keep going.
Right.
Um, and I do know that therapy can be inaccessible, cost-wise. Ask about sliding scale fees, ask about, different programs that will pay for therapy, because they're out there.
Mhm.
If you're in college, take advantage of it because therapy is, like, worked into your tuition that you're
Right.
paying for. So,
Right.
like, go.
Mhm.
Um, yeah, and if you wanna be a therapist, hit me up. I can help. It's not easy to go through bureaucracy.
Right.
So, yeah.
Yep. And if you don't know how to get to Nicole, get to me, and then I'll get
Yeah.
to Nicole for you. That's
Yes.
what the comment section is for. Comment, and I will get
Perfect.
your question to Nicole.
Yeah.
Easy peasy.
Yes.
Yeah.
Please. And if you have questions about therapy, about what I do, literally anything, I'm incredibly open. So ask me anything and don't be weird to disabled people. That's
They're people
that's
too.
it.
Yeah.
Yeah.
Yeah. How dare other people?
I
How
know.
dare?
How dare.
How dare? Well, thank you so much, Nicole,
Yeah,
for
thanks for
coming
having
on
me.
and yeah, sharing your stuff with us.
Absolutely.
We all appreciate it.
Thank you.
Um, and this has been Fantastic Female Role Models. I hope you got something out of it if you watch, and if you didn't, well then watch a different one and get something out of that one.
All right.
Bye.
Bye. Thanks, Mike.
Yep.